Migraine treatment success secret number 11, vitamin D. You always seem to hear in the news that there's always some new vitamin to consider or new deficiency to consider, but when it comes to migraines or any autoimmune condition, it's very important that patients are taking vitamin D to help their immune system. Modern diets are lacking in vitamin D-rich foods. And what are these vitamin D-rich foods? Well, liver, and honestly, not many people like liver, organ meats, lard, many forms of seafood, butter, and egg yolks. Remember what I said about eating eggs for breakfast and how important it is in your blood glucose level. Egg yolks do not add fat or cholesterol to our bloodstream. Sunlight is another important factor in source of vitamin D, but you should never take vitamin D without having your vitamin D levels tested, specifically 25 OHD and 125 OHD. Most MDs will only test 25 OHD, but it's important to have both levels tested. This way you're eliminating the guesswork. You could be low in vitamin D or on the low side of normal. Either finding would constitute a different recommended dosage. Why is vitamin D so important? Vitamin D deficiency is associated with many autoimmune conditions. Frankly, autoimmune rates have been skyrocketing in the past 20 years, which is correlated with the decreased levels of vitamin D in the general population. Adequate vitamin D levels helps to keep the immune system balanced so it doesn't swing out of control into an autoimmune disease. When it comes to migraines, the problems with vitamin D deficiency is made worse by genetics. Many people, especially people suffering from migraines, need higher amounts of vitamin D to maintain health, even if their blood tests show sufficient vitamin D. Do not take vitamin D without having your blood levels tested. You need both 25 HD and 125 OHD tested. 25 is the storage form and 125 is the active form. You need both levels checked. In many cases, patients will come to my office with only one level checked and their vitamin D levels will be on the low side of normal. Their MD has told them, "You're fine, there's nothing wrong with you," when actually if you're on the low side of normal, you need to be supplementing with vitamin D. I recommend that all my patients with migraines or any other autoimmune condition take extra vitamin D if indicated. Don't suffer another minute. Call our office at 336-229-4226 and schedule 2 free visits with Dr. Naylor. Call now. Space is limited.